Now, consultant doctors and junior doctors are today taking joint strike action. Doctors have said they will operate Christmas Day levels, that kind of service, providing only emergency care. The government says around 900,000 appointments have already been cancelled as a result of doctor strikes this year. In July, junior doctors were awarded a 6% pay rise and £1,250 for the 2023-24 year. But the British Medical Association trade union says they are still facing a pay cut in real terms. Consultants also received a 6% rise, but the BMA, which represents nearly 200,000 doctors in Britain, said they are seeking a rise above the level of RPI inflation for the 12 months to April. That's 11.4%. Is this really doable? Let's speak to Dr Arjan Singh, Chair of the BMA North Thames Regional Junior Doctors Committee. Arjan, good afternoon to you.
Good afternoon.
The government's position, of course, look, we've given you a pay rise, we've done what we can, we have to be realistic, people are dying, the waiting lists are growing, and it's all your fault.
So, yeah, this offer that Dave talks about, this pay rise, it's disingenuously disguised as such. It doesn't match inflation this year, so it's another pay cut. It doesn't make a dent in the preceding 15 years of inflation. It still means a doctor is on £15 an hour when they start work. And the government have said that this offer is what we're worth, it's fair and it's reasonable. Well, it doesn't take our pay back to our COVID salary. So the government is insinuating that doctors that went into the pandemic with no protection, who had to wear bin bags, were overpaid, which is quite frankly disgusting.
Lots of people, well, very few doctors had to wear bin bags. Come on, Arjan.
No, doctors did have to wear bin bags.
Some might have done when they couldn't get their hands on some protection, but it wasn't the norm, was it?
It was very normal that we did not have PPE and people were sharing masks in the pandemic. And this offer that the amount of money that we're after in total, to contextualise it, is £1 billion net. The government has spent well over £1 billion covering our strike action. So they're putting party politics over common sense and logic. And in fact, 63% of the British public agree that the money spent covering our strikes should have been given to us.
Just talk us through, as someone you are a clinician, this is your job, your profession, your vocation, you wanted to do it, you studied for it, you passed the exams, you became a doctor. But it's not turned out quite how you thought it would when it comes to pay and conditions. Just tell us about your own struggles, Arjan, then. What does it mean for you day to day? Is it the gas bill that's a problem? Is it something else? What's it like?
So when I decided to pursue a career in medicine, we're talking about 10 or 11 years ago, and the pay is very different. In fact, we're asking for our pay to be restored to the level that it was in 2008, so very similar to that number. We're not asking for, our ask is not one of largesse. We're asking for £20 an hour for a doctor, far below our global market value. But because doctors' pay has been vociferously cut, we don't have enough doctors. Okay. We're 9,000 juniors short, the same number of consultants, and when we're going into work, we're having to do the job of multiple doctors. And when you're doing the job of
we certainly no, I don't think anybody would dispute that. We need more doctors. I don't even think Steve Barclay would dispute that point. But how are you struggling, Arjan? Given that you're the doctor I'm talking to right now, just give us a flavour of your own struggles.
As a doctor, it's virtually impossible to get on the housing ladder. People are putting off getting into training because you get paid more if you're not in training and you're locuming than if you're a doctor, which is why this pay issue makes no sense. We spend £3 billion a year on agency staff in the NHS, including doctors, where you have to pay them more money because there's not enough doctors working on a full-time NHS contract because the pay is so poor. And majority of doctors now are thinking about exit strategies, and I'm no different. There's a shortage of doctors globally in America, Canada, Australia, and they're recruiting us aggressively. They're remunerating us appropriately, they're respecting us accordingly, and they're giving us the environment where we can provide top quality care and we get respected.
Is there not a wider issue here, though? And whilst people will, how much do you pay a doctor, how much do you pay a nurse, how much do you pay a consultant, etc., of course, people who are trained in very specialised areas, I think most people support and want to make sure that you're looked over. Overarchingly, however, It is a good career and it's a great package. It's a job for life. It has all of that, and it's in the public sector. And sometimes the public sector, whether it's in medicine, whether it's in teaching, wherever it happens to be, does take a bit of a hit. It's almost, dare I say, a payoff for working in such a secure industry where you've got a nice pension and you can expand, you can move into private if you want to. There is a kind of trade-off here in many respects, is there not, Arjan, in the sense that, you know, yes, you have been denied pay rises at incremental levels throughout the last year, but it'll all come out in the wash. You've got other things that are going for you that people in other sectors could only dream of. You're doing all right, really, aren't you?
So you mentioned the public sector. Well, I'll give you a comparison which will shock you. Okay, the NHS workforce plan, which the government has endorsed, is talking about tripling the number of physician assistants. Now, physician assistants, as the name suggests, are assistants to doctors. Okay, they've not gone to medical school. They've done a 2-year degree instead. They're not independent. We have to supervise them. We have to double check everything they do. And they're not regulated. Yet, our assistants are getting paid £10,000 to £15,000 more than doctors. And the workforce plan is talking about tripling the number of our assistants. Now, aside from the huge patient safety issues of such expansion, it's quite clear that the money is there to go somewhere. It's giving us a credible...
Sure, but of course your money won't remain static, whereas the assistant's money probably will, broadly speaking. Your money can become, well, it's not long before, as a doctor, you are in the six-figure salary territory, right?
So this is another interesting point. We've had an increase in the number of medical school places and doctors. We haven't had an increase in the number of training places, which is what you require to become a consultant. Now, to get into training to become a consultant, the competition could be something like 10 to 1. We have a huge shortage of people that can't become consultants and will never become consultants and get to that salary that you are talking about.
Just in layman's terms then, if you could, what is it you specifically want? What would you settle for right now? If Steve Barclay was sitting right next to me, what a delight that would be too. What would the figure be that you would put on it, Arjan?
Yeah, I'll give you a figure right now, actually. If Steve Barclay can tell me that a doctor that is with £100,000 of student debt is worth £20 an hour, then we'll call off the strikes right now. If he can tell me that a doctor that is going to sacrifice the next 15 years of their life moving up and down the country at the whim of the NHS, sacrificing friendships and relationships is worth £20 an hour, we will call off these strikes. And if he can tell us that a doctor that is the first port of call for 100 patients overnight and is starting life-saving treatment on our loved ones is worth £20 an hour, we'll call off the strikes right now.
And sitting on the other side of me is a bereaved family member whose partner or child or father, mother, whatever, died because they were denied treatment because of these strikes. What do you say to them?
We've been on strike. Well, firstly, doctors are patients. My family members are patients with grandparents that have had appointments and procedures cancelled during these set of strikes. We opened our pay dispute with the government last year, well before any strikes were planned. And we said, please negotiate with our pay. They said, don't come back to us until you've got a mandate for strike action. And right now, and this is going to shock you, we've got 500 British people dying every single week needlessly because there aren't enough doctors. That's according to the Royal College of Emergency Medicine.
But you would acknowledge, I mean, what do you say to people who might die because you're waiting for a scan? I need a cancer scan right now. I've got to get my pancreas scanned. If I don't get it scanned, there's going to be a problem. It's been postponed again. What do you say to that patient? Look them in the eye. What do you say to them?
This decision to go on strike is heartbreaking. No one wants to do this at all. We're suffering, patients are suffering, the NHS and the system is on its knees right now. We have collapsed. We have people on a normal day, not a strike day, on a normal day, that are waiting more than 12 hours in A&E waiting rooms to get seen. We have people having heart attacks in waiting rooms, that die in waiting rooms, people having strokes and being paralysed because there aren't enough doctors. Why? Because our pay has been cut.
We need more doctors indeed, but no consolation. Those waiting lists are increasing while you're on strike. We've got the person waiting for the scan or the consultation or the procedure. It's been cancelled. Their life is in jeopardy. Would you apologise to them?
I would like to apologise on behalf of the British government.
As a doctor who's part of this strike action, would you apologise to somebody in a perilous position for their health or a bereaved family member because your strike action meant their procedure was cancelled? Would you say sorry?
Oh, it is a horrific position to be in. I'm very sorry for patients who are undergoing delayed appointments, and have had appointments that have been waiting for 6 months or a year before they've been seen. We have to ask the question, why were they waiting so long to get seen? Well, there's no doctors to see them. Why? Because our pay keeps getting cut. All we're asking for is £20 an hour. That is not
And the strikes continue? They will carry on until you get this? Forever?
So we've reballoted our members very recently, and unlike most industrial action disputes where the second mandate is weaker than the first, our one has increased in strength by 7,000 people. The BMA has a record number of members, over 200,000 people now. It's been deemed as the strongest union in the country. Doctors are acutely aware this is the very last chance we have of restoring our profession, that it's on its knees. It's the last chance saloon, and doctors are willing to go on strike for our profession for as long as it takes.
OK, thank you. Dr Arjan Singh, he is the chair of the BMA North Thames Regional Junior Doctors Committee. Response to that, I don't know if that was an unequivocal in the eyes apology, but you heard it there. 0344 499 1000.